Yes, now we're recording.
Thank you. So, call to order. I'd like to entertain a motion for approval of the minutes of October 18th.
I think we need to fill in item number 2 before we can ask for approval.
What do you fill in?
We weren't remembering.
Oh, yes, yeah, no, but we can ask for a motion, and then we can, afterwards, we can, so if we
I'll
can get a
motion.
motion for
I'll motion.
approval.
Motion for approval.
Okay, so Laurie motion, second?
Second.
Second, Nancy. Discussion on the minutes? Any changes?
Does anyone remember who motioned for approval of the minutes last
Time?
So long ago.
It was Molly.
It was Molly?
Yeah, sure.
You motioned and seconded? Who seconded? Was it?
I actually guessed Abby, but I don't know.
Sure. Yeah. I did second at one point, so yeah.
You guys were both sitting here.
Right there,
And
yeah.
it sounded like it was coming from there, but I
Yes,
wasn't
yep, it was the two of
100%
us.
sure. Okay.
Okay. All in favor of approval of the minutes of 10:18, say aye.
Aye.
Right.
Any nays? Any abstentions? Motion passes. Thank you. Kim McNamara, our favorite health information officer.
Shall I just sit here?
Sure.
Can everyone?
So I'm just going to give you a brief update of where we are with the community health profile and needs assessment, and where it seems that we can move forward now that we've broken it into segments. The data gathering work is now underway by the Community Health Institute out of Concord, and that portion will be completed by December 15th with a simple report, and of course, all the data in files that we can manipulate. They will also update us if there are sections of the profile that are completed prior to that date. The next steps are we're going to begin the information gathering of vulnerable populations and describe individual and collective challenges. Since this group here is a very strong collection representing vulnerable populations in Portsmouth, we would like to connect with this group as an initial contact group. And I'm asking if you would be willing to devote one meeting for these members here to discuss 2 questions that we have to kick off the process. The questions will be, we'd like to know what your experience as an organization has been, what makes it difficult for you to provide services to the populations that you serve. And the second question is, what is your perception of the impact of COVID and everything else that came with it over the last 3 years on the people that you serve? From that meeting, we will develop specific focus groups for the populations served and others that might not be represented at this table, but to make sure that we include all those that we know about and any that we learn about from the data gathering that's going on. We're looking at facilitators for this next segment of focus groups. We're talking to 2 now. And we will likely also use key informant interviews as part of that process. And it's from these focus groups that much of the narrative, and from the interviews, that much of the narrative about specifically what is happening in Portsmouth will be written. So we're about to start that stage. That is my update.
I missed the date. JSI's doing the report, and then,
By December 15th, it's due.
okay.
But beyond December 15th for that initial data gathering phase, and this other phase that you're talking about that you'd like to involve this group, that's going into next year?
We can start that as soon as you agree. So if you said, yes, you could have a meeting, and you gave us a date for a meeting, we would start at that date with this group, and then from this group, break it off into, who should be the focus group for our unsheltered homeless population, who should be the focus group for our developmentally disabled, and so on and so forth. So we would have several focus groups going on at the same time, but it will start, if you're willing to have this group serve as that initial discussion.
I'll speak for myself. I think that would be a wonderful idea. My concern would be that I believe we have 3 meetings left through this month and December before we have to report out to the city council and we need those meetings to really put our report together. So I'll open it up to the floor for ideas, because I think that's an important thing that we should be definitely engaging in. I'm just wondering if how we're going to fit it in before the end of the year.
I agree. I think we need a separate meeting.
Could we add a meeting for the week that we're not meeting, one of the weeks, the Tuesdays? I don't know if people could do that, but.
You could also extend this meeting by an hour, whatever, if you had critical mass at one of our standing meetings,
Okay.
whatever the group thinks is more doable.
And I think that maybe we can discuss that later on, but we certainly, so I think you have a yes from the committee. We'll have to figure out whether it's an extended hour or whether we fit it in at some other point before the end of the year. Does that make sense to you guys?
Yes.
Okay. Thank you, Kim.
Thank you.
Next, we have Ellen Tully, who is, Ellen, is your title Director of
Welfare
Welfare?
Administrator.
Okay, thank you.
Hi, everyone. Before I tell you about what I think is going to happen when I look in my crystal ball, I want to give you a little history of what's happened in the welfare office in the last few years. Prior to COVID, the 3 quarters prior to COVID, which was in FY20, I was spending about $27,000 a month, and that's pretty average. It was not untoward. And that year, I had 469 office visits. The following year, 263 office visits. I spent $165,000, which was extremely low for the considering. And the following year after that, FY22, I only saw 65 people, and I spent less than $40,000, which is, I've spent that much in a month before. So far this year, we are seeing very few people, assisting very few people, but of course, I expect that to change in the pretty near future because the ERAP money is gone, and that's where primarily the savings have come about to my office.
Just so people know, what does ERAP stand for?
Emergency Rental Assistance Program.
Thank you.
It's the money that you've been hearing about. The governor needed to do something. We did end up getting a couple of $1 million more money in the state of New Hampshire, but it's only 2 days worth of money, so it's not going to make much of a difference.
And you're saying most of that money's already spent?
Yes, it's gone.
It's gone?
Yeah.
Okay.
Can I ask a quick question? Do you know what happened with all of the rental assistance money the county had?
Spent.
All of that, because they were having trouble spending that, right?
Well, they were having trouble spending it. There were 2 phases of money, the first phase and the second phase. The state was having trouble with the first phase because it was hard to get them up and running, I guess, to get the program going, and they took a long time doing it. And I don't know exactly why, but the second phase of money was easier to get going and spend, so they spent the second phase of the money. They had to give back a whole bunch of the first phase.
So they did give back. Okay.
Yeah. So my immediate concern is that there are hundreds and hundreds of people across the state who are living in motels who cannot self-pay going forward. And I happen, just one motel in Portsmouth, Stratford County has filled 18 rooms at the Anchorage Motel with Stratford County residents. Now the money's running out and they're calling us. We are doing our best to return them to the town of their origin. But if they self-pay for 2 or 3 nights, then they belong to the city of Portsmouth. And there's nothing we can do about it, really. I've had considerable discussions with the welfare officers in Stratford County, most notably Rochester, Somersworth, and Dover. And we are all in agreement that, no, the folks shouldn't be the responsibility of the city of Portsmouth, but it doesn't always work the way we want it to. And also, another thing that has acted in our favor in the last few years is that the Portsmouth Housing Authority has not evicted anybody based on money. Their evictions have been for lease violations only, and I'm afraid that that may come to an end as well. So we'll do our best to keep anybody who's in public housing, But it's just just a little bit of a forecast of things to come.
Alan, the reason why PHA has not evicted anybody because of money is because they're getting the ARPA funds?
They
to-
are getting some of the funds, and because when an applicant applies, they can get their back rent paid as well as rent going forward. But now that the money's gone, I'm not really sure what's going to happen. Because I know of somebody right now who's over at one of the family units, and they owe $3,000 in back rent, and they've used all of the ARPA money. Folks got kind of complacent. They didn't pay their rent for 18 months, and now all of a sudden they have to pay again, and they don't know how to do it anymore, you know? It's very difficult.
I'll say that, based on what Ellen is saying, that we are going to see a huge influx of people, individuals and families into the shelter, certainly into Crossroads. I was speaking to Betsy Andrews Parker, who's the executive director of Stratford County CAP, the other day, and she said she has 185 hotel rooms. I don't know how many there are. That's just in Stratford County through CAP. I don't know how many there are in Rockingham County, but it's a significant vulnerable population that are going to find themselves all of a sudden homeless, and it's going to be a significant challenge for us.
Yes.
In addition to that, and this is just hot off the press, we're going to serve as the Rockingham County emergency winter shelter. So that is going to happen as well. So we will be able to accommodate some folks during really, really cold days. So that's going to put some additional pressure, certainly on Crossroads House. But this is a this is a
Yes,
problem. that we're
and
gonna-
this population includes people who are barred from Crossroads House, who traditionally would have doubled up with family and friends, and they didn't have the need to do that with the money that was available to them, but now they have to negotiate all of those things that they haven't had to do in the last few years.
Yeah.
How much was that money and what was the time frame of it being spent?
Every individual, people who applied, they could get up to 18 months of their rent paid. They could also, some of that money could also be used to utilize paying their utility bills. So it was a pretty significant lifestyle change for some people to not have to pay your rent or your utilities for 18 months is a big deal.
So that, when is that ending?
It's done.
It's done already?
They stopped taking applications October 23rd.
Okay, that's what I heard. What does that mean for these people?
If you're, for instance, if you're in a motel, you can't recertify to get more money. You're done. And the hotel people are really, across the state, this is the population that the welfare administrators are concerned about. Because these are folks who can't get into because of any variety of reasons, can't get into an apartment, can't get into another motel, they can't get into a shelter. And I had to put 2 families in a motel yesterday at $660 a week in the cheapest motel in Portsmouth. And that's not going to go away anytime soon. You know, because obviously, as Will knows, there's a huge bottleneck at Crossroads House, especially for families. And so it's going to be a long-term thing for us.
And it couldn't come at the worst time of the year. We're going into the winter months.
Right.
So, anything else you're done?
No, I wasn't getting any more questions, so I thought I'd sneak away.
Quietly. Thank you, Ellen.
Thank you.
Okay. So next up, Seacoast Public Health Network, and who are we speaking with?
Maria Reyes.
Maria Reyes.
Can you spell your last name?
Yes, R-E-Y-E-S.
Thank you.
Welcome.
Thank you. So I'm here to provide some information about the Seacoast Public Health. I'm the Continuum of Care Facilitator, and it's a pleasure to be here. I've always wanted to come, but I was pulled away in other projects, and of course, COVID-19 really monopolized our lives. So, but it's nice to start peeking out again. Basically, to prepare for this, I did a mini youth survey, and most of the populations that I deal with are youth and young adults, all the way to elder adults. We were trying to do a trans kind of generational program with young adults and older adults living together in these units this is something we made up and we created, but we're still looking for the funding to do that. So I work with AARP, Scott Bogle, and he is coming up with some really good programs right now for that project. So we did a little survey just to give you a little snapshot of what's going on in the Seacoast Public Health. I work in the 23 towns. Portsmouth, I used to work before the pandemic hit. I worked with just about everybody, especially during the Integrated Delivery Network, if some of you probably know about that. And that's where all of my focus was. So now we're trying to execute some projects, some programs, and people, if you have any ideas, brainstorm. If you want to text me or email me, I'm happy to look at things, and maybe we can come up with some really good innovative ideas. We've executed some really fantastic programs over the years, and our greatest assets is our coalitions. We have 3 coalitions: the SOROC Coalition, the Raymond for Youth Coalition, and all of our partners like Austin 17 House. These are youth-serving organizations that are just powerhouses when it comes to executing deliverables. And so I partner very closely with them. This last 2 years, they really worked hard on the 988 Eye Care Suicide Prevention Initiative. The youth did some incredible signs and really promoted it in a way that there's no way we could do it. So that was really fantastic. And the Raymond for Youth Coalition, that's been around forever. They also did, they focused on vaping, because vaping is still quite a problem with young people. And Austin 17 House, I don't know if you all are familiar with that. They're in Brentwood, and they have a very nice facility that has an array of skills, life skills for young people, from youth, young adults. Parents can go there, and they really concentrate on the life skills like, cooking, really cool outdoor projects, like they work in a farm, and all the way from helping out in any way they can, learning their schoolwork. So they have like these classrooms, and I've been there a million times, and I love it. They have such a powerful presence, and they really genuinely have kids that just love to be there, which is like amazing. So, and they've been around for a few years, and they have much more funding than they used to be. We've also been helping in that area. So they're the boots on the ground that are executing a lot of these projects. And my goal is to make sure that they have the funding and that they continue the progress that they're making, because this is something that is very valuable to the Seacoast Public Health region. And really the top concerns for youth is having safe alternative activities. That's often sometimes a problem. And the other areas of concern are the mental health, especially with depression, suicide ideation, and suicide attempts. That has been on the rise for the last, I would say, before the pandemic, and it just went off the charts during the pandemic. And I know I'm preaching to the choir here, so please forgive me for that, but it still needs to be said what's going on. Also, the transitional period from high school to college is a vulnerable period, so we are really throwing our assets in that area as well, and that's really making an impact. We also want the young adults to be the key players here. I am an adult, but I like to get myself out of there. I give them information when they need it, but it's amazing some of the stuff they do. They take the ball and they run with it, and this is exactly what we need. Family stress is at an all-time high. COVID, the social determinants of health have been a huge impact on people. Lack of transportation, food access, the usual stuff that is really impairing people. And family stress, the biggest one right now is inflation. Just going to the grocery bill gives me like angina because it's unbelievably expensive. So I can't imagine for folks who cannot afford food. It's either, if you're really low income, you can get some support, but if you're in the middle, sometimes is where people are being affected. Basically, let me see if there's anything else. The same drugs with the lethality of fentanyl is the game changer. So we are really looking at that, especially with young people. Just a little bit of that fentanyl is so lethal that we're doing everything we can to educate the community, both the families and the youth, about this. And let me see if there's anything else I missed, or if you have any questions that you'd like to ask.
I have a quick question.
Yes,
When you
please.
mentioned trying to ensure that the folks had the funding that they need, where do your resources come from?
Our resources come from, from the grants from the state. We have different pockets of money through that. We have the New Hampshire Charitable Foundation. They also provide some funding. We're doing a project with them. And those are the main ones, is the state and New Hampshire Charitable. And there's some others that escape me right now, but if you need a full list, I can get you that.
And who exactly is the Public Health Network?
Who is it?
You mentioned the 3 coalitions, but
Okay, they're part of the Seacoast Public Health. We have 23 towns, including the city of Portsmouth. So that's a lot of
so
towns.
there's representation from each of those?
Yes, there is, in various degrees. Like SoRock is part Seacoast Public Health, and they also are part of another region because they got split. And it's a little complicated how the public health networks evolved. But right now we have the 23 towns of Seacoast Public Health, and that's a lot. And I can't be at all places. I have other colleagues that work, but they work in different areas like FEP, Public Health Emergency, and we have, it's just me, FEP, and we break ourselves apart, so to speak, and we do things from lead poisoning prevention. We do a lot of the young adult strategy grant. We do older adults. I mean, we cover the whole range of the age span. So
Who asked that question? What were the 3 coalitions?
the 3 coalitions are SoRock.
Pardon me?
SoRock, S-O, capital Rock, R-O-C-K.
And these all different places in the state?
No, this is just the Seacoast Public Health
Seacoast,
region.
okay,
Yeah.
Seacoast, okay.
And if you want to look to see what the towns are, just go on our website, Seacoast Public Health Network.
Is that what you mean by coalitions, based on different towns or different, it's different?
The coalitions, like the Raymond for Youth is in Raymond.
Okay.
And that's part of the Seacoast Public Health.
Okay.
And the SoRock, they're part of the Seacoast Public Health. They are also part of South Central region. It's just
Okay.
the way that they are geographically, so they're kind of broken up. And then Austin 17 House is not really a coalition, they're a youth-serving organization. So those are our big partners right there. Yes?
I just had a question about the youth survey, the safe alternative activities. Can you talk a little bit about explain that a little bit, what that might mean?
Yeah, the safe alternative activities are things like when they participate in some of the projects that we are working with, for example, Austin 17, there may be some vulnerable youth that have been using drugs and alcohol. And the prescription drug abuse has been escalating. So we target these kids to either go to Raymond for Youth Coalition or to Austin 17 House, just to increase those protective factors and decrease the risk factors that they're heading into. So we try to use the prevention model to, to help them not go there.
Thank you.
Yep.
Is the website seacoastpublichealth.org or what's that?
It's Seacoast Public Health Network.
Okay.
If you just plug in that,
Okay.
it'll come up.
Yep.
And it's just been revised, so.
Okay.
So, Maria, right?
Yes.
If you had to say, this is all these challenges and issues that we're dealing during COVID and post-COVID, and we had a limited number of funds, and obviously the funds apply particularly to the city of Portsmouth. That's our catchment. But what would you recommend to this committee to consider in terms of where we should be putting our money, or making recommendations to the city
Right.
council?
Thank you for that question. I think the most important thing is using young people to really, blaze the trail. They have been phenomenal, the folks that I've been working with, and I don't want to exclude other populations, but youth and young adult historically haven't gotten that much attention. And so, but we're throwing a lot of assets in that direction, and we're seeing really fantastic results. So my money is with that. And then on the other hand, I also have a passion for older adults. So I want to make sure that they have the resources, because they're often a forgotten group of people. So, and working with ARP has been phenomenal, because they are putting some resources in that area. So I would say the young folks, the earlier, the better the intervention is my philosophy. And, that's not rocket science. The earlier you intervene, the better the prognosis. So, and that's the way we've been doing it for I've been working with public health for about 8 years now, so.
Can I just ask two questions, Maria?
Absolutely.
So, the Austin 17 House, for example, so
Yep.
if they needed funding, they would come to you as the Seacoast Public Health Network?
Not necessarily. They have other resources.
Okay.
They've got lots of different folks that support them.
Okay.
We do some funding, but, we'll do typically grants. Like, for example, we funded a small grant to Magnolia House. They're still kind of new. They've been around, I think, going on their third year.
Okay.
So we've been very close partners with Jules Johnson at Magnolia House, and they just opened up Summerwood House. There is a shortage of recovery houses. I mean, it's not a flash bulletin. It's been ongoing. Very difficult to get recovery housing. So this is another passion of mine, to try to get funding for that, because the work that they're doing at Magnolia House has been absolutely phenomenal. So they just need more resources.
Okay. And then the other question, I just wanted to go back to the youth and young adults and older adults living together project that you're working on.
This is a dream.
Okay. So this is a dream. Now it just sounds awesome. So that is something that is kind of like a dream scenario that you would have to fundraise for, et cetera.
Yeah, it would be. Yes, I haven't given up on that. I've seen models in the country that I'm very excited, and when I see it, I go, oh my goodness, because I'm older adult, so I would like to be a part of that action. So, and I think it would be good, because we can learn from each other, and some of the data that I've seen has just been outstanding. So, anything that jazzes me up like that, and our team is very out of the box. So we sit around and just brainstorm about dreaming about these projects and programs, and some of them have come to fruition. So, it's worth doing that, I think.
Thanks.
Yep.
Other questions? Thank you, Maria. Really appreciate you coming.
Thank you kindly. I appreciate it.
Okay, so we're now going to open it up to the committee for discussion on where we're heading, and I know that Abby, you had I believe it was you, right, Abby,
Yeah.
that had proposed doing some sort of a graph for us that,
I did. Karen, did you get that?
I did. The
Okay.
question is, should I try to share it here? I didn't get my act together in time, so.
Well, that's, I mean, if
Bear
not
with me a
today, we
sec.
can do it next time. But yeah, so
I
I did,
can-
I did make a Google slideshow, so I shared it with Karen, just of a format that we could stick our ideas in it, and then that we would have something to present to the council. So I think we talked about, did we talk about December 5th is the council meeting? That's
Yep.
right?
What's the next to meet together?
That's the city council meeting.
Oh, the council meeting.
Yeah.
Okay.
So just the idea that we would spend, because what do we have, 2 more meetings? This November 15th and 29th to put our ideas into a format to share. And I think as Karen said, it doesn't have to be finalized, but at least we'd have something to share. So yeah, I mean, I basically just did the slides with all of our headings, put our community members, I'll add, I kind of did Q&As so that people could see all of the people we've had come in and talk to us, you know, that could be part of it too. Yeah, so
All right,
just,
I'm making it,
obviously this is just what I came up with, we can.
I don't know
change
Google
it.
Docs. How do you make it
Oh.
full screen? At file
If you go
view?
in slideshow on the top right, keep going over. Sorry, am I right? Yep.
Okay, look at that.
So I just, yeah, so like I said, this is just what I came up with, but we can do whatever. But
great.
just doing our mission statement there. So I pulled those out of the notes that we had from our meetings, just so I thought that if we were presenting to the council, this is just a reminder of what our mission is.
Great.
And then you want to go to the next one, Karen? Our names, who we are.
Okay.
Next.
We can make sure this is to everyone's satisfaction
Yeah.
as we refine it.
Well, and that's the other thing, I didn't know if I share it for everyone, or if you are the gatekeeper, how that works, I don't know. So I will add our other speakers we had visit us today, so that we just can kind of show that we've been talking to all these people and getting all this information.
Very
and
nice.
then the critical needs that we had kind of
identified early on. Yeah.
And then I just did a couple slides where we would put our ideas as we brainstorm them at the meetings. So
Okay.
that
That's
was my
great.
thought, but we
Oh,
could
thank you for doing
do
that.
whatever,
you, Abby.
change it,
Great.
whatever, so.
What were the 4? Your transportation, what were the?
Let me back up.
Yeah.
Yeah.
So those were the 4 we had identified, kind of when we had gone around the room.
Okay.
I'm happy to circulate this.
Oh, thank you.
I apologize. I think that I let the group down by not circulating.
No, I didn't know, honestly. I was like, I can do it. I don't know if I'm supposed to do it, like trying to follow the rules.
I'll have
So I just
Jessica
sent
send
to
it
you.
out after this.
Right.
Can I ask a question on this process?
Yeah.
Because I don't want to overstep whatever the state laws are on being able to contribute to the document.
Right.
Is that allowed? Are we allowed to?
It's a great question.
Because that's the part I didn't know, because I was like, are we allowed to put in ideas, or does it all need to be, well, we sit here that we're putting in the ideas?
I'm going to say that that could be problematic. So let me get confirmation of that let me try to do that while we're sitting here.
Okay.
Thank you.
Because I thought twofold, that if we shared it as a doc, we could put things in and then join to talk about them. But if that's not the case, then maybe we're just jotting them down or something, and then everyone goes around
Make sure we
and I just
bring-
enter as we sit here.
I can work on a document myself and then bring it to the meeting.
Right, like we could all do that kind of
And
thing
share it.
between, and then just share our ideas.
And then one person just is
And then just be the
the
note taker, and I
coordinator.
can, yeah. And then as we sit here, I can type in your ideas into the document, if we're not allowed to do it outside of the meeting.
Let's go on that assumption until I
Okay.
get clarification.
Yep.
But I do like the idea of people doing their own work and bringing it back
Yep.
here.
Yep.
Okay. Yeah, so I think, I don't know how we want to do it, if we want to just then kind of go through slides and then,
Housing isn't listed
Yeah, I
here,
was just going to say that.
and that clearly is a
yep.
area of
Totally.
need. So
If I modify it here, that's the beauty of a Google Doc, right? It saves.
Yep,
Is that correct?
yep, so just enter in.
thank you, Karen.
Welcome. Learn something new every day.
That's an
I got your back. I got your back. In terms of the slides that follow, I am a little uncertain, and I apologize, I wasn't here for the last meeting. Is this committee, there was a conversation about like suggesting that a fleet of vehicles were procured somehow. And I guess I was coming to this group and task with a little bit of a different optic. Since there are organizations and structures in place that know this work the best and know how to best and most efficiently spend money and spend dollars and run those programs, that perhaps we would take the position of providing a list of organizations that in their mission, that is one of their priorities. So obviously, if we wanted to suggest that some money be spent to house those who need it, who are vulnerable, particularly in this upcoming season, that we would indicate Crossroads House. Like we would then have a list of organizations that provide housing in part of their service provisions. And that we aren't the ones to say, we think you should buy a bunch of cars to be able to drive these people around. We think you should have a bucket of money and you guys decide what you're going to do with it. Not for us to get that weedy about it. But then after hearing the meeting the last time you guys were together, it seemed to go further into the weeds. So I just wanted to get clarification from the group about what we're thinking.
Well, doesn't it matter, like, the funds have to be spent on in a specific way, right? So if we were to say, Crossroads as an example, give them a bucket of money, that would be considered unrestricted, and they could spend it as they want. And I don't think that was the mission of this money.
I think procedurally, if the group and the city council, more of the city council, were to direct funds to a specific recipient, there are very specific restrictions and rules about subrecipients' use of funds and reporting of the use of funds. It gets messier, I'll say, less seamless than the city spending the money itself. So the city would be making a deliberate appropriation of funds and turning the end user of those funds into a subrecipient of the grant, for which there are reporting requirements.
Okay.
I don't know if I answered your question.
I mean, I agree that makes the most sense to do it that way, even though it's more complicated, because those are the experts out there. The city may not have that expertise or working with that population.
And like, I'm sort of thinking of dialing it back. Like, so the city council doesn't have the lived experience to know of all of the organizations that are doing the work in these particular categories. So I think step one is partly just education. Like, did you know that there's all of these organizations in the Seacoast region that are focused on transportation, mental health, workforce, childcare, housing, and some obviously are going to cross, right? Like there's some organizations that have multiple focuses in their missions. So if we at least start with some sort of identification of what those organizations are that are doing this work already, and then the council could come back to us and say, this is fantastic. Can you now do X, Y, and Z? I feel so uncomfortable about overstepping the expertise of a group, an established nonprofit that has been doing this stuff for years, to say, this is what we think is best that you do with this money. I don't know.
I do think that there might be opportunity for a little of both. Like, part of what I see our task is to try to use our expertise and knowledge to be a little creative on, is there an opportunity of some collaborative piece that could be done and invested in that would help multiple organizations addressing the same issue? Or is it around specific things that it would make more sense to have some, restricted funding, but funding that was for the organizations to come up with creative ways to address a certain topic area that we've identified. And I think for me, the best way to do it is to just, let's dive into these different topic areas and come up with what do we think? Is there any sort of creative idea, or do we need to leave it up to those organizations? And Because, I mean, so many of them do cross over, like everything up there.
Right.
And for me, I think, to add to what Laurie and Kathy said, part of the exercise that we're going through is, at least in my mind, is we have limited funds, and we're talking about post-COVID, how do we help some of these vulnerable populations, both in the immediate and longer term. So that means, how do we, as nonprofits, working with the city, leverage these funds as best as we can? And part of that is going to require, I think to Kathy's point, that we work together as best we can, find ways to leverage resources and say, okay, we have this problem, whether it's in childcare, housing, transportation, et cetera, and how do we ensure that we are thinking about that long term and take the resources that the city has and allocate them in the best way possible, so that, again, we are bringing our collective brain trust and resources to the table to work together. And that's, I say that because I think that we're all well-intentioned, but a lot of times we are in our own little worlds trying to solve the problems that are immediate to our nonprofits, and not really kind of coming outside the box and thinking, okay, how do we figure out the problem around childcare and or mental health collectively? And I think that there's an opportunity here for the city council for us to guide the city council to think in those terms. So at least that's an opportunity that I see here.
Yeah. Should we try an exercise where we take transportation, for instance, and say, okay, this is the problem that we've learned about. This is what we identify as, just as a group, what we learned. And then that's part of the transportation. And then the other part would be like, what solutions do we see? What organizations would be involved? And what would be the recommendations of the group? So each area is split up into two. What we've learned is the problem, and then what are some suggested organizations and suggested ideas? Because that's really what it's just an idea, right? We're just going to give what we've learned.
Yep. I like the idea, I like the idea of identifying what the problem is, and then here's some suggested solutions, and here's the organizations that are focused in that area.
Yeah.
At least as a starting point, maybe?
I can take notes.
The resources idea.
I just think we would be remiss if we missed public health, either framing mental health and substance misuse under public health, so that we're capturing the full scope of that bullet point. I think leaving out substance misuse and other aspects of public health would be a problem.
Yeah, good point.
We could define the headings too, to
How
what
do
they
you
include.
do you want that to be added to this slide, since we got it up and I'm typing?
I think substance abuse misuse is its own
Yeah.
category.
Yeah, we can't solve housing
Oh, whoa.
or workforce shortage unless we look at the substance misuse point of entry. Yeah. I mean, and we could argue that public health encapsulates all of these, right?
What else am I writing, Whitney?
I think you could write substance misuse and leave it at that.
Okay.
So, we want to start with transportation, and
Try as a question.
Guests speak?
I don't see why not.
I think the group formally would vote to allow members of the public to speak.
Oh, that would be public comment?
So you make a motion?
No, you can suspend the rules to allow folks to speak at any point in the meeting.
Okay, so we take a vote? Is that the way it works? We'll take a vote?
Yeah.
Okay. Those in favor of allowing Kim McNamara to speak?
And any
as a
other
guest?
guests?
And any other guests?
Yeah.
Say aye.
And for the record, I know Tori Jennison is also participating via Zoom, so you may hear from Tori if she wants to chime in.
Okay. Go ahead, Kim.
Thank you. What you're talking about is so important with the narratives that I spoke about, because you're looking at subjects like transportation and housing. We're looking at groups of people that are affected by those things. And so I know that our timing may not work out perfectly with your December deadline, but those narratives are going to get to exactly how transportation affects people who, Seacoast Mental Health may have funding to provide services, but if people can't get there, that's a transportation issue. And then, you might have people with developmental disabilities that work in a certain location downtown, but they can't continue with their job because they don't have transportation. So all of these different narratives from the different subpopulations of vulnerable people are going to tell you an awful lot about the subjects that you're talking about up here. So again, as far as the timing goes, we'll do our best to get it to you as soon as we can, but it's very important those narratives be paid attention to. Thank you.
If I can, to the chair, Kim, you may or may not have been in the room when we've talked about giving the council a status update on where we are, and perhaps it includes an extension request to be able to incorporate what you find out, knowing that you'd be delayed a little bit. So
Thank you.
I don't think this group should feel jammed in an artificial deadline if it needs more time to incorporate what you're working on.
Thank you.
Thank you, Kim.
As long as you've suspended the rules.
Oh, yeah.
Come on up.
Calm down.
So to piggyback on what Kim had to say about all of these things being interconnected, I'd like to speak to the fact that 15 years ago, the city of Portsmouth had a number of rooming houses. Primarily, there was a large rooming house at 21 Brewster Street. It had 32 rooms, so you could often find as many as 50 people in there. There are couples, singles, whatever you had. And folks who lived there, it didn't matter if they were drinking on a daily basis. It didn't matter if they came home high. It didn't matter if they were spending $750 of their $800 a month income on their rent. It was a place for them to live, and they could stay there. And so there was 21 Brewster Street. They had 32 rooms. Years ago, 18 Islington Street was a rooming house. They probably had about 15 rooms. And now the only one remaining in town is Dan's Rooms, and I'm not sure, maybe he's got a dozen rooms down there. But this is the kind of place that we need to have, where people can go and just live their life with whatever their issues are. I know that Whitney often sees folks who need exactly that. They just need a room to land. It doesn't have to be anything fancy. A shared bathroom is fine with everybody, generally speaking. And so I think when you talk about housing, you need to talk about places where people who have been barred or evicted, there needs to be a place for these folks to go where they can live out their lives however they do without having to be constrained by a lot of rules and regulations.
Thank you, Ellen. That's very important to note. So we have another 10 minutes or so. How do you want to spend it? Do you want to go through this one by one and talk about transportation?
I have a question for transportation. Prior to this moment or this time, that this is a major issue, which it is, where did the money come from before? To have the, means of transportation up to this point. Where's that from?
Well, it's not just the money, it's
Yeah.
the lack of workforce.
Yeah.
I thought you also said you needed, besides workforce, you also needed some other new vehicles. That was mentioned at one point, or at least a conversation I had with some people. So it's mostly workforce. That's what we're
That's
saying.
what we
with this
heard
one.
when we had our
So
guest speaker.
that's the critical part of why we list that. It's not the need for new or updated or anything.
Well, I think if we go through this exercise, and particularly around transportation, we can identify what we heard as
Okay.
the challenges, and then we
Okay.
can come up with some things, and then maybe, I really like the idea of doing this, and then we could take the other topic areas and come to the next meeting prepared to do the same thing with
Okay.
Yeah.
all of them, so that we're just really
Yep.
diving right in.
Oh, my goodness.
So Karen, you can share this over so at least they can look through it. We just won't edit it.
Correct.
Outside of the meeting. And
Until
then-
we get guidance that says we could otherwise.
And
Yep.
then if everyone brings however it works for you, type it, write it, whatever, and then we'll just add it here.
So he also talked about how to be able to drive those buses. That there's a lag, there's only one place in the state of New Hampshire or
I think
something
there's
like
only one
that.
school that you could
One
get your
school,
CDL
right.
license.
CDL. CDL licenses, yeah.
And it's also expensive to get your CDL license.
Yeah.
So that can also, it can be cost prohibitive for folks to be able to pay for them to get the training they need.
Yep.
Okay.
And also, wasn't one of the things Rad said post-COVID was that a lot of drivers are driving for like Amazon and other places.
That are getting paid more.
Paid more, but they'll burn out faster, but,
So the
so the
wages
drivers,
are
that's
an
also a
issue.
workforce issue.
I'm just spitballing here. We can finesse
Yeah,
this
yeah, we can
later.
fix it.
And then
Yeah.
also the difficulty of finding other transportation, like less Uber availability, and so even if you have the resources, not having access to.
And one of the impacts of a lack of workforce is that you have to shut down specific routes. So that creates gaps for people to make connections and so on and so forth. So in a sense, for the vulnerable populations, they need to get to their doctor's appointments, to jobs, and so on and so forth. It makes it usually challenging. Yeah.
I think as we tease this out, we will get to this to figure out what format is going to make the most sense. But I think it's going to be important to also include why this is a problem and what the impact of the community health is that those folks who rely on public transportation now can't get to medical appointments. They can't get their prescriptions. They can't sometimes perhaps get to procure food. I mean, the list goes on. And
Well, when we heard Maria say that it puts huge stress on families and individuals.
Exactly. So we can figure out where it makes sense and how, like what formatting stuff.
But I think that's good because what's the problem, what's the impact, and what are the solutions? And then maybe another one is what are some agencies that we know of that
Exactly.
could tackle that?
Exactly.
Or piece.
So this is so the transportation issue is in itself a structural challenge for vulnerable populations, but it impacts public health, and from there, who knows what else? I mean, it could lead to other things, but certainly the public health.
Can I say an impact public health? It also affects people's employment, like if parents, it can affect their job if they can't get kids places.
Yep.
Well, we also heard from the school department
How do I
about
say
the
that, Mimi?
limited buses and the ability for kids to have access to
Job stability.
after-school activities and.
They do have limited, yeah.
Right.
Employment, I don't know. Keeping a job.
I feel like we're getting some really good momentum right now, and this is very exciting.
Well, I think we have a format to follow for each
Except
one,
for it's
too,
all
would be
about
good.
what the issues are,
Well,
instead
yeah,
of
right.
how we're going to fix them.
I want to also note that thank you, Kim, and all the work that you're doing to get a new assessment and all of that stuff created. Exeter Hospital just published their most recent public health assessment. If anybody's like just curious about what they look like, and it did include Portsmouth as one of the regions that they studied. It would just be helpful driver maybe for some of these discussions. And I think Wentworth Douglas has a recent one out as well. Likely the same issues are going to be highlighted.
So I don't know if this, I think we've got transportation, but driver's ed right now is incredibly expensive. It's about $900 a kid. And they don't give scholarships typically. So that's preventive, I would say, of youth being able to gain a life skill, being able to drive. And we want safe drivers. We don't want them to wait until they're 18 to just walk in and, take the test and
Figure it out.
Right.
So that would be a solution, right? One of the
That's a problem. I don't know how to.
Well, it could
Right,
be
but
there
a
could be
solution could be
scholarships to
yeah, or
drivers ed.
subsidized or whatever. Yeah.
I've never had so many people watch me type before.
It's stressful, isn't it?
Makes you feel better. I can't see it. So.
Perfect.
If there's typos.
More slides.
Well, I know that. Oh, I'm sorry. But I think the school department. I know I remember the superintendent saying that they are like chronically late for school and then chronically late to get home or to the activities. So again, that's like just stress building, little pieces every day.
Yeah.
And missed things, right? Like if they're late to school and they're getting breakfast in school and they miss.
Right.
So something like transportation has a huge domino effect on all aspects of an individual's life or a family life. Do we want to add some solutions that, I mean, this will continue to evolve, so maybe if you have any thoughts on potential solutions?
Scholarships for the CDL too, or something, maybe.
Yep, I got that up there.
Yeah.
What about the one that the superintendent mentioned, like buying a van or
Through the city or through rec department or something.
at least for the school kids?
Yeah, like the third party buying non-CDL vehicles.
Right.
And then doing it that way.
I wrote down a to-do for me to find out is if the city were to spend ARPA money buying a fleet of vehicles, how could those be utilized? What's the liability? We have our insurance carrier. What would they say about that? How do we operationalize that? So let me look into that.
I mean, the one thing that, for that particular issue that comes to mind for me is who drives those? Where's the workforce? I mean, if we don't have a workforce to drive the regular buses, how are we going to find?
I was also had this idea the last time we met, just about a solution idea. I didn't know if, at least for the city, like for the school department, and thinking about Andrew's, vision about high impact, low cost. Like how could we use the fire department or the police force or retired for like I don't know. I don't know how. I was just thinking in the realm of like who we already have on our team, so to speak, as drivers.
Well, that's a good segue. Councilor Bagley keeps checking in with me. Hey, does it make sense for me to come join a meeting? And I said, I haven't heard that yet. You're always welcome, but maybe that could be if he's able to join us either in person or by Zoom for the next meeting, just to see how we're doing.
Right.
Yeah.
He does say that he watches every meeting, so he's up to speed, but it might be good to have him here.
And I have a question. Is there still the advantage of when you work for the city or the schools that there's pension plans? Because that probably doesn't happen in the bus companies.
Correct.
Say that again.
Say it again.
So if you
Use the
work for
microphone, Janet.
Sorry, if you work for the schools or the city, there's pension plans. So if you can talk to the drivers about that, there's an advantage of doing that,
Right.
having regular money when you retire, versus working for Coast or, because my guess is they don't have pensions. I could be wrong, but.
Right.
So.
I think also there's the part-time workforce availability. If we were creative with perhaps issuing vouchers directly for their housing, for instance, so it's not included as their income, because I think that's the concern, right? We have this whole workforce that might be on, let's say, SSDI, and they have a certain limit. But they are perfectly great drivers, right? And they're looking for purposeful activity. As long as there was a way to pay directly the vendor, it's not their income, and that might be a workaround. And then we keep people housed at the same time.
What was that, SSI?
SSDI.
And people Medicare, too.
Exactly. Those are oftentimes Social Security disability recipients.
So I really like Whitney's and Amber's ideas around part-time workers or workers who are maybe able to take some degree of hours on to do some of this work, but yet they're not being tapped, which means if we were to recommend something like this, there would have to be some sort of a marketing campaign to recruit. And but if there is a part-time workforce out there to do some of this, we definitely should be. And it sounds like there would be if we approach it correctly.
It's just they're not going to respond to financial bonus and incentives. because it's threatening.
On the other side of that, I'm just thinking of utilizing some of the community colleges that are in the area to help with that marketing, and potentially to be drivers. My next question in my brain went to, so who would run all of this? Like, this has to be housed under some umbrella, because we're not the ones that are going to manage all of this. So who runs it? Is it a city? Is it, like, that's...
So I'm wondering, since we, have 2 meetings to do this? Like, I really like the idea of throwing out these ideas and, like, we're finishing up this meeting, in the next meeting, coming with all of our ideas, getting them all out there, and then taking that the third meeting to really look at, okay, these are some of the recommendations that were thrown out there. Let's kind of see if there's any that resonate with all of us, like, this is what we want to put our committee behind.
And can we maybe extend one of our meetings so that, like, even if it's the last meeting before we are with the city council, just to not walk away and feel like, oh gosh, we're not finished?
Yeah, we're probably going to have to do that, but also to, if we want to include Kim and the work that they're doing, so that's...
But there also is a calendar invite for a meeting that's after the city council meeting.
Right.
I don't know if that would make sense for
Right.
what Kim requested.
Yeah.
The 13th.
Yeah.
Okay.
I have a question.
We have to shut down.
All these other topics that we, mental health, workforce shortage, childcare, housing, all of that. I don't know how we're going to have, meeting 3 more times, how we're going to have enough time to discuss all these different.
We will.
Because that's our homework.
That's our homework,
is
yeah.
It's
to-
homework, but I'm talking about it as a group.
Well, we don't have a choice. We're going to have to figure it out and have an extension of a meeting. Fortunately, we're past
Motion.
1 o'clock, so there's a motion to adjourn. Second?
Second.
Thank you. All those in favor of closing down the meeting, say aye.
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 Thank you very much.
We didn't
Meeting is
do
closed.
public comment.